Kerala, which recorded India's first coronavirus cases, grabbed international attention by succeeding in flattening the curve. After the initial surge in March and April, the state successfully brought down the new cases to zero on many days in May. But recently, by the end of June, Kerala has been witnessing a resurgence in the number of COVID-19 cases. Kerala increased its testing rates by a high margin in the initial months of the pandemic. However, after the economy opened up and migrants from abroad and other states started to return, the state was not able to test enough despite a significant increase in tests. As relaxations came in by mid-May, it created a false sense of safety in people, leading them to violate social distancing and quarantine norms. Also, unannounced entry of people through the porous borders of Thiruvananthapuram, Wayanad and Kannur made tracking difficult. Ceremonies such as marriages were held against stipulations leading to spread of infection. Thus, by the end of June, a wide cluster of infections in Ponnani Taluk in Malappuram was identified. This was followed by a lockdown in the taluk. Meanwhile, infections with no known source of origin emerged, prompting the government to admit community transmission in the coastal pockets of Thiruvananthapuram. Misleading campaigns and a fear of another lockdown upsetting their livelihoods made the people restless in critical containment zones such as Puntura in coastal Thiruvananthapuram. The situation came under control once the government announced relief measures. An aging but active population, a high degree of comorbidities in its people, and population density are some of the factors that contribute to Kerala's vulnerability to the pandemic. Despite community transmission, it has been able to maintain a cumulative test positivity rate of 2.6% and a fatality rate of 0.32%, which is among the best. The current positivity rate of 4.6%, which is much better than the national average of 11.7%, calls for doubling the rate of testing in the state. But the cases are now doubling in 10 to 11 days, whereas nationally it's 18 to 20 days.